be real. Parenting is not easy, but you are not alone. Welcome to the Parent Prescription, a podcast where I will give you real, practical advice to help navigate the ups and downs of raising healthy, happy kiddos without losing your mind. Today's episode, we are going to talk about the benefits of breastfeeding. It is Breastfeeding Awareness Month. And so it is the end of Breastfeeding Awareness Month. So since it's August, I figured this is a perfect time to talk about the benefits of breastfeeding. I feel like there's not a lot of information out there for us sometimes, and we are just rolling with it. We're just trying. Okay. And so I do want to give you the benefits of it. I do want to tell you what's normal because we hear all of these stories. And so I want you to hang tight and sit back and listen to this episode on the benefits of breastfeeding during Breastfeeding Awareness Month. Okay, so August is Breastfeeding Awareness Month. And I am excited to say that I was a breastfeeding mama. Woo, it was hard. So let's just start with that. Breastfeeding was hard. It was a challenge. And so I don't think that we hear all these beautiful stories, the benefits and the overflow and the women that just loved it. And that's not my story. Uh, but I do want everyone to realize that there are some benefits not only for the baby, but for the mom, for the child as they are actually growing and developing. And that it's a challenge that is well worth it. Okay. And so, why even talk about breastfeeding? And so, I believe that we are doing a better job from the beginning, from the hospital. We have lactation nurses on hand. And as soon as a mom delivers, the first question is, are you going to be breastfeeding? We can go ahead and do skin to skin and let the baby try to latch. And that is usually the way it goes in the hospital now, which is a beautiful thing. There was a time when we didn't promote it as much. But now you should, if you didn't experience that, you should have experienced someone coming in the room and asking if you were going to breastfeed and if you want um, the lactation specialist to come in and help you out. And especially for first times moms, it can be a little stressful, right? And so let's start with the benefits for the baby. Okay, so first, human milk is human milk. And so we try to emulate human milk with our formulas and things like that. But human milk is what it is. It's human milk. It has more protection, antibodies to protect against diseases and infections. It helps more with brain development and growth. When we talk about breast milk, the reason why we promote the human breast milk for babies is because it has more things for the baby to fight off infections, to develop, to grow naturally. It's just point blank more natural. Okay? And so that is why, this is more to support you. There are some that try very hard and it just doesn't happen. But I think we have sometimes false expectations, and we're going to get into that. But the main benefit for children is that you're getting the antibodies out of the milk that helps you to fight off viruses and infections better because you have the antibodies from the start. Also, the bond that it creates. When you have the skin to skin and the natural breastfeeding attachment that babies get with their moms, there is a bond that it produces. And it's a healthy bond, not only for mom, but for the baby also. So it is a healthy attachment that we have when we have breastfeeding families. Okay. When we talk about benefits for mom, we are talking about the the letdown that happens is important for mom to be able to naturally feed the baby, to be able to have that happen. Also, when we talk about the benefits for mom, of course, the first one is the attachment that you get from the beginning. Yes, we all have an attachment or should have an attachment to our babies, but there is a bond that is created when you breastfeed because you're having to do the skin to skin, you're having to do the attachment to the nipple, you're having to have that close bond to the baby, and it creates a sense of attachment for you, also for the mom, also. Again, although some mothers find it very rewarding and emotional to breastfeed their babies, some do find it stressful and a little overwhelming. And so it can be an emotional thing where you're actively trying to do what's best for the baby, but it is causing some stress. And so you have to make sure that balance is there where it is okay if you say, I am going to do this for a certain amount of time because I know the benefits that the baby gets, or I am going to do this, but I'm also going to supplement so daddy can help feed also, and it doesn't have to only be on mom. And so I do want to throw that in there too, the emotional aspect of it. But breastfeeding produces certain hormones that helps our body to extend the time or limit this time or the possibility, the risk of breast and ovarian cancers. It also um, helps with the bleeding after pregnancy, after delivery. It helps with that to reduce that in a shorter amount of time when you're breastfeeding. And so there is benefits for mom also when we talk about breastfeeding. Okay. When we talk about the time frame, I think sometimes we have a misconception that when you are eating right and you're drinking plenty of water, it's supposed to be like an automatic, the baby latches, we feed, and it's like it's just as smooth as butter. But that's not always the case. And that's why we have lactation specialists and lactation nurses to help us through, especially the beginning. Positioning makes a difference when we talk about the football hold or the normal hold. When we talk about these things, it's so that we can know it may not be as easy as cake when we talk about breastfeeding. And so we talk about the hold, we talk about the first 4 to 7 days, it may just be colostrum at the beginning, which is your that milk that comes out at the very beginning that's full of nutrients and antibodies. But you may not get a full 2 ounce bottle when you first start pumping. You may not get that. And so sometimes it's frustrating because your sister may have been somebody that pumps 6 ounces and 6 to 8 ounces each time, or that has an oversupply, and that may not be the case for you, and it may not be because you're doing anything wrong. And so I do want to encourage moms to give themselves time to be able to produce and relax and be in a position where we're not having a million people stop by the house, and we're comfortable and we're able to snack and eat and drink and do all those things necessary for our body to be able to produce. There are things that help with that, and so lots of fluids, obviously. um, your protein snacks with protein, peanuts, peanut butter, oatmeal. Again, lots of fluids, but making sure we're eating and snacking is helpful. But I do want to say, give yourself grace if it's not happening the way you think it should happen. Even if it has to be supplemented, they're still getting breast milk. Okay. And so I wanted to just encourage people as far as breastfeeding. It's not taboo. It's still happening. We still encourage it. It's still the best things for babies, especially if they are premature, born early. They really would benefit from having breast milk, even if it's donor breast milk. But encouraging you to give yourself grace and patience. It is Breastfeeding Awareness Month, and wanting to say congratulations to those that have done it. Congratulations to those of you that have tried it and it was so difficult that you were like, we're going to supplement. I'm going to do what I can, but this is stressing me out. But know that it is still what is recommended, what is best for babies, especially the first 6 months of life. And it is your story may be different from somebody else's, and it is okay. It is okay. So, Breastfeeding Awareness Month. Breast milk has benefits not only for baby, but also for mom. And everyone's story looks different, but I encourage you to give yourself grace and be patient. So, thank you for joining us with this podcast this week on breastfeeding benefits.